the treatment of breast cancer actually occurs in a variety of different settings. So if we focus on early stage disease, generally treatment has been after diagnosis and then surgery. So you take out the tumor, you examine the draining lymph nodes, and then you provide treatment to kill microscopic cells that could be somewhere in the body that would eventually result in recurrence of disease. And women get confused, and all patients do, about what the recurrence means. So when we see a patient with early diagnosis, new diagnosis of early stage disease, we're focusing on reducing recurrence both locally, so in the breast. You want to have good margins, all the things the surgeon takes care of, the radiation doctors take care of, and we give treatment for, will markedly reduce local recurrence in the breast that was affected. But we are focusing primarily in terms of our decisions in systemic treatment options on preventing distant recurrence. So what that is cells that travel through the lymph or blood vessels and end up in other organs. And we know they hide out various places. Most of the time, clearly, they don't come back, but sometimes they do, and we can't detect them, so we give treatment to kill them. Now, there's a third reason that treatment is given and screening is done, and that's to prevent new breast cancers. But most of our focus is to prevent recurrence of the cancer you got diagnosed with, the evil you know, versus the evil you don't know. That's really more in the prevention area where women are at higher risk. Now, treatment is generally given, as I mentioned, after surgery, but it could also be given before surgery, and that's become increasingly popular, and I actually think that that's an area that's going to continue to grow. And the reason for that is that you have the tumor in the breast, so you can feel it, you can see it by radiographic procedures, so mammogram, MRI of the breast, and so you can get a biopsy, get a little piece of the tissue, examine it, provide treatment, see what happens, and potentially then use the information you've gathered from the response as well as the tissue you've removed to actually improve on that treatment. So that's really the key of individualizing therapy is first we have to understand what the tissue is telling us, what the response is telling us, then we can intervene with more effective therapies.